Hi, I'm Dr. Rob Danoff for ARIA Health, Medical Mythbusters. All right, here's the question. Is this a myth or is this a fact? Using a hand sanitizer on a regular basis can help protect you from the flu. Is that a myth or is that a fact? I see lots of people out there starting to wash their hands. Well, for those who said it's a fact, you're right. The flu is a respiratory virus. And the way most people get it is by touching a contaminated surface, such as a keyboard or a doorknob, and then touching their eyes, their nose, and their mouth. In fact, do you know that most people touch their face at least 6 times per hour and don't even realize it? So, by keeping our hands clean with a hand sanitizer and keeping the virus away, we have less of a risk of getting the flu. Now, what are some other myth or facts? All right, is this a myth or fact? Doc, I already had the flu once this season. I don't need the vaccine. Is that a myth or is that a fact? Well, that's a myth because you know what? You can get the flu virus multiple times during the flu season because there's different strains of the flu. That's why you want to get the flu vaccine if you can. The reason? The flu vaccine protects us against 3 different types of flu. All right, next one I hear. Is this a myth or is this a fact? Doc, the flu is a virus. Most people do fine. It's not dangerous. Why should I get the flu shot? I don't need one. Is that a myth or is that a fact? Well, that's actually a myth. We need the flu vaccine. The reason the flu is responsible for over 36,000 deaths each and every year and for causing over 200,000 hospitalizations each and every year because of complications related to the flu. And here's another benefit. Those people who get the flu vaccine have a decreased risk for a heart attack during the flu season. That's new information, but it seems to be true. All right, is this a myth or is this a fact? Doc, antibiotics will take care of it if I get the flu. Is that a myth or is that a fact? Well, the answer is that's a myth. Antibiotics are only for bacterial illnesses, and the flu is a virus. So we do have antiviral medications we can use to decrease the severity of the flu and decrease the length that you have the flu by about 2 days, but you need to speak with your doctor because we have to start the medicine within 48 hours to be most effective. All right? One more. Is this a myth or is this a fact? Doc, I got the flu vaccine last year and I got the flu. It was from the vaccine. Is that a myth or is that a fact? Well, that's actually a myth. We can't get the flu from the flu vaccine. The reason, the flu vaccine is made up of a dead virus. And well, it's dead. So you can't get it. However, during the flu season, there are other colds around, or you might have been exposed to the flu before the vaccine. And it takes up to 4 days to start showing the signs of the flu. Now, there is a live vaccine that's given through your nose, but that usually does not give the flu to anybody because it's such a weakened flu virus that the parts that can cause the flu are taken out. So the flu vaccine is safe and effective, and if you're able to take it, please speak with your doctor to see if it's right for you. For more information, please go to yourariahealth.org.